Good.
Okay. Give me a signal. Hi, and welcome to our first ever live.
Hold on. Yeah, I got a pulse. I'm live.
So, as you can see, he can be funny sometimes. And honestly, there's multiple purposes to doing these lives once a week. And one of them is to show you that he is human and he can actually smile sometimes. I'm here to make sure he's human, so that's how this is going to work. So we'll give you just a quick introduction about who we are in case you don't know who we are. So, Dr. Sosa.
What? Everybody knows who I am. I'm Grumpy Doc. I'm Dr. Sosa, bariatric surgeon.
Been doing surgery for?
Well, bariatric surgeon is like 2001. Before that, I was a trauma surgeon at Jackson Memorial. And let me tell you, trauma gets old. I'm working at 2 a.m. every night. So I found bariatric surgery and I changed my career. This is a lot more fun.
And give us a little bit of your certifications and your qualifications.
Oh, this is the part that embarrasses me because I hate bragging. So I went to medical school in University of South Florida, where I graduated at the top of my class and took this thing called the National Boards, where I got 99%. So then
So you were very smart once upon a time.
I was studious. Now not so much. Now it's video games. But I'm still good at what I do. I still remember back then. So then I went to the University of Miami, Jackson Memorial Hospital, to do my 5 years of general surgery. And I fell in love with trauma. And Jackson was one of the top trauma centers in the country. So I was a trauma surgeon on the faculty for a couple of years. Then I came out into private practice and I was part-time trauma, part-time general surgery. Then I discovered you, and then we discovered bariatric surgery, and we completely changed our practice and our lives.
Absolutely. We started off in a tiny little office in a warehouse that faced a garbage can.
A dumpster.
A dumpster. Practicing barely half a day a week. And then from there we moved 2 or 3 times till we made it to our current building, the Sosa Clinic and the Sosa Way. For those of you who don't know me, I'm Christina Sosa, Dr. Sosa's better half.
Better.
His human half. And we've been here in this location since 1999, so quite a long time. No intentions of going anywhere else.
Here to retirement home. I'm already picking the place at the Villages where I get to retire. 10 years.
I'm putting him in the home since I'm a lot younger, and I'm going to stick around. So I'll keep the business going for a lot longer than that.
Yep.
But we've been here since 1999. And for those of you who have visited the office, it's a small 2-story building. And we have it divided into 2 sections. So the Sosa Clinic, which is primarily our surgery practice, and the Sosa Way, which is my baby, which encompasses everything else. Nutrition, vitamins, supplements, weight loss for patients that didn't have surgery. So we really go for a holistic approach, and that's really my favorite part of it. But we'll talk a little bit about surgery first, and we'll let Dr. Sosa tell us, answer some questions about surgery for those of you that need more information.
First, I want to do my plug. Here's my plug. So the other day I was checking out an anti-aging clinic because I want to, not age. And the doctor is this old-looking guy, all wrinkled and slightly obese. And I'm like, wait a minute, you're the expert in anti-aging and you look like an old obese guy? No, I'm not going to you. So my point being that we don't only walk the talk, we live the talk. So we're very much into health, we're very much into calorie counting, we're very much into supplements, we're very much into staying young, staying in shape, and we've learned a lot about how to do that successfully. And that's what we bring to you. And we don't just bring the surgery, which is amazing, but after the surgery, we have all these other philosophies that we bring. Some of our patients take advantage of it, some don't. My advice is take advantage of it because it's a complete approach to a longer, healthier life.
So just want to say a quick hello to Chini7. Hi, thank you for joining us. And your plug though, were you going to mention about where you started in your weight loss journey?
I mean, if you guys have followed my funny Instagram, well, not my serious. This is
His
more
personal
serious. My
one.
personal, where I make a lot of jokes, etc. But I posted a picture of myself when I was a BMI of 32. I love BMIs more than weight. But in weight, I was probably around 230, which I'm not a very, well, I'm kind of tall. Well, actually, I'm not really tall. Well, I'm actually kind of short, okay, honestly. I'm a little short. So at my height, 230 something pounds I was severely obese. Not exactly at 35 morbidly obese, but currently I would actually have met criteria for weight loss surgery because now we're going down to a BMI of 30. And I was not healthy and not happy. And it's taking a long, long time using many, many techniques to finally get my weight under control and stay at a healthy weight. And that's what we bring you. The science of it, the medicine of it, the
practice of it.
Right. Almost the holistic part of it too. It's a commitment. It's a commitment to living a certain way, and living thinner, healthier is much easier to be happy. It's like money. It doesn't make you happy, but it sure makes it easier to be happy.
And so just going back to a little bit of our background. So when Dr. Sosa started performing bariatric surgery in 2001, we actually opened our own gym that was a private gym only for bariatric surgery patients. It became too much for us to handle, so we do not have it anymore. But we did have it for almost 5 years. And during that time, I got very invested in working with the patients and working out with the patients, and I became a certified personal trainer. So I actually passed my test, got my certification, and I would teach classes at the gym and do personal training with the patients at the gym. And a lot of our old patients still remember those wonderful times. We really did become like a family, and we are still friends to this day with a lot of those patients. So although we no longer have the gym, we figured now that there is social media, we can come to you guys live at least once a week for 30 minutes, help encourage you, help answer some questions, and make this a family approach once again.
So I am famously known for my very, very brief visits, whether it's in the hospital or whether it's in the office. You basically got 3 minutes. If you have questions, I'll extend it to 5 minutes, but I'm all about efficiency. But a thing like this and the old in-person support groups allowed me to have the time where I'm not working, where I'm not in my efficient mode, to sit here and talk to you, answer your questions. So we hope this series grows into that when you want to spend more time with me, but I have patients to see and surgeries to do, I'm efficient. But right now, I have time. Ask me anything, ask me questions, there is no such thing as silly questions. It took me a lot of years to learn some of the things that I know. Some I learned through science, through the medical studies, through published papers, etc. Some I learned by living it, and some I learned from my own patients by seeing how they do and what works and what doesn't. So that's the time to really talk to me on a personal basis, because if you come to the office, you're on the clock.
I mean, he is all about efficiency, but not only that, when you come to the office, he is here to figure out if you have a real problem and a problem that he needs to address. So this is going to be more general questions. We'll answer any questions, but slightly more general questions, slightly on a hopefully funner, happier note. We'll be talking about different things. So let's start at the beginning. What's a BMI?
Okay, so it's a really complicated formula, so no one can do it. That's why we have calculators do it. It uses your height, but actually in meters, and it uses your weight, but actually in kilograms. And what it basically does is it relates your weight to your height and gives you an index that can measure, for the most part, how much fat, how obese you have in your body. Now, where does it fall apart? It falls apart on truly muscular people. And I'm not talking you go to the gym like I do a little bit here and there. I'm talking truly bodybuilders, football players, because their BMI is very high, but it's not fat, it's pure muscle, so it doesn't hurt their health. But for most average people, the BMI clearly tells you how obese you are, to the point that studies correlated it to health. And what the study shows, if your BMI is between 20 and 25, your weight, your obesity, your fat content is not going to change your life for better or for worse. You're great, you're in health. When you're 25 to 30, you begin to see a little bit of problems associated with too much adipose tissue, fat. And those problems can be some hormonal interchanges, a little bit of high blood pressure, a little bit of bad proteins in your blood that are inflammatory. When your BMI is over 30, you're considered obese. Now, here's where we begin to see that fat causing problems. People think fat is just stores energy. It does, but fat actually is what we call metabolically active. But everything it makes is bad for you. They're inflammatory proteins, they're hormones, and they hurt your health. So once your BMI is over 30, you begin to see high blood pressure, high cholesterol, diabetes, coronary heart disease, higher incidence of cancer. So after 35, you're considered morbidly obese. Why? We have a survival curve that clearly, when you hit 35, your long-term survival markedly drops. So at that point, the obesity is killing you younger. And if you stay severely obese from a young age, you're going to lose about 10 years of your longevity of your life from early death, heart attack, infarct, stroke, cancers. That's what we mean to stop when we do weight loss surgery or when we do very aggressive weight management. So that's your BMI. You can calculate it. Go on one of the apps, call us, we'll do your BMI for you because I can't do the formula, so I have to look it up.
So we have actually a couple of questions. So how long is each surgery? And well, we currently do 2 surgeries in the practice. So how long does it take to do each surgery?
So we do 3 surgeries because the third one is the more complicated. So a sleeve gastrectomy typically takes me around 40 minutes. I always tell patients an hour. I tell an hour to everybody for everything. Because the truth of the matter is the gastric bypass takes me an hour. The sleeve gastrectomy takes me about 10, 15 minutes less, 40, 45 minutes. Obviously, it depends on how big the person is. If I'm dealing with a young man that weighs 500 pounds and I do that often, the surgery is a bit longer. If I'm dealing with, somebody who's only 50 pounds overweight and is just getting a sleeve, much easier operation, much faster. But the sleeve, generally 40, 45 minutes, the gastric bypass 1 hour. The third operation that we do, which we're doing more and more, is we take failed sleeves and convert them to gastric bypass. That takes about an hour and a half because we have to deal with the previous scar from the previous sleeve. Why am I so fast? When you look around at other bariatric surgeons, again, I hesitate to brag, but sometimes I gotta brag. Surgeons that can do the surgery this well, this fast, with these results are about 1 to 5% of all the surgeons in the US. Most average surgeons take 2 hours, 2.5 hours. So folks come with that expectation, but I tell them, no, our team takes 1 hour. Now, yes, it has to do with my brilliance, but it really also has to do with my team. So these folks, the person that hands me the instruments, the person that holds things for me, holds the camera, retracts for me, anesthesia, they've been with me for years, some up to 20 years. So they're incredibly fine-tuned. It's like you're putting in a team that plays every day for 5 years. Everybody knows what they're doing versus a bunch of rookies all together thrown. That's the big difference, and that's why our team is so fast. Is it important to be fast? Yes. The longer you're under anesthesia, the higher rates of complications from pulmonary problems, blood clots, etc. So I always tell people, if you're slow and bad, bad surgeon. If you're slow and good, okay. If you're fast and good, best results.
So how long did you say for the conversions?
The conversions take about an hour and a half.
And that's from the sleeve to the gastric?
From the sleeve to the gastric.
And a band to the gastric?
It's about the same. We'll have to remove the band and then do the gastric. So it takes about an hour and a half.
Okay. And then we have another question. Oh, and Wanda says that amo a este doctor.
Gracias, Wanda. Pocas personas me aman.
Yo a veces. Okay, the other question we had was about pregnancy after surgery. So this is specifically from a patient who had a sleeve 7 months ago, and she wants to know about pregnancy after surgery.
Okay, so the standard answer that everyone will give you is a year to a year and a half. Wait a year to a year and a half to get pregnant. The new studies show that folks who got pregnant before a year had the same, by the way, really good outcomes with pregnancy than the folks who waited a year to a year and a half. Clearly, while you're still severely obese the first few months, it's probably not the best idea to get pregnant. But once you've lost a significant amount of weight, the truth of the matter is, if you get pregnant, especially sometimes folks are not planning and they're pregnant and they start freaking out, I tell them, listen, don't worry. The new studies show the success of the pregnancy, the health of the baby will be as good as if you have waited a year to a year and a half. So the standard college answer is a year to a year and a half. If you get pregnant prior to a year, no big deal with the studies, as long as you take your vitamins, because the baby needs vitamins. So you need to give the baby vitamins. If you're getting pregnant, if you're pregnant and you have bariatric surgery, come see me. I'll give you the guidelines on the medications. We'll follow your vitamin levels, and we should have a very nice, healthy pregnancy.
So there is something that some of you may not know, that prior to COVID, we had live seminars, once a month in English, once a month in Spanish. And at these seminars, we also had the support groups. One of the things that was one of your favorite things to say at the seminars was when patients asked, how long do I need to be your patient? And your answer is?
Till you die or till I die. It's a forever relationship. So it's kind of like, well, no, she's going to put me in a nursing home before. But yeah, my answer to patients is a lifelong relationship. You need to see me once a year forever. Guess what the studies show? The patients that show up once a year do much better keeping their weight off long term than the patients that disappear for 10 or 20 years. It's obvious. If you show up once a year, A, you're interested. B, I'm going to give you feedback sooner. Hey, you gained 10 pounds. Let's do something about it. Hey, you gained 20 pounds. Let's do something about it. That is much easier than, hey, you haven't seen me in 10 years. You gained 70 pounds. Now what are we going to do about it? So lifelong follow-ups, see me at least once a year, or my nurse practitioner if you're doing great. It helps maintaining long-term weight loss.
So just to touch a little bit about our comprehensive program, also going back to the patients when they get pregnant or the patients that are just had surgery, our nutritionists play an integral part of our program. So although he gives you a 3-minute visit in the office, that is a very good thing, because when you have a 3-minute visit with him, that means that you're not having any complications and you're feeling well and doing well. He will take his time if you're not feeling well, but 3-minute visit, good thing. Second thing is our nutritionists do give you 30 minutes of their time. So it is a timed visit, but it is a much longer visit. And they're going to be there to help you answer your questions about what you need to eat. And if you're not feeling well, they're going to customize your nutrition plan to you. So yes, we give you a handout that is same guidelines for everybody, but it does get customized depending on the patient and how they're tolerating their diet. So we also have the nutritionist, and we also have our nurse practitioner. We also have our medical assistant, and then we have our ancillary staff of the psychologist. So there's a lot of members of the team to help you through this whole process before you have surgery and after you have surgery. So don't disappear, and use all of these tools to help you get to your successful weight after surgery.
So this, as an aside here, if you're not feeling well, if you're sick, I'm going to spend time figuring out what's wrong. I'm going to spend time helping you better. If you're doing great, you're going to see my nurse practitioner. She's much more pleasant than me. And you're doing great, you're on track, everything's good, you're going to see the nurse practitioner. Why? It's efficient. But if you're sick, if you need me, I'll be there. Many a times I have spent the entire night next to a patient's bed taking care of them when they're sick. So don't think that I'm not going to be there for you. What I'm not really going to do is chit-chat with you all afternoon while I'm seeing patients. But here I will chit-chat with you.
So another question related to pregnancy. So if they were pregnant and then want to have surgery after a pregnancy, how long should they wait?
I mean, the standard answer is if you had a C-section, 6 weeks. If you had spontaneous delivery, a month. You probably want to wait a bit longer, but that's as fast as you could do it. Something very important. If you're breastfeeding, you should not have surgery, because many of the things we give you to have surgery can go, including the pain medication, can go through the breast milk into the baby. So you got to plan that out. So a reasonable amount of time till the baby's good, till you're good, but medically speaking, 6 weeks.
Okay. Let's talk a little bit about the actual surgeries, the different surgeries, and who they're good for.
Okay, so this is a fascinating part, and it's I feel like Don Quixote going against the windmills. And what are the windmills? The windmills are all the sleeve surgeons in town. Everybody's now a sleeve surgeon, and everybody's telling patients the sleeve is the best operation. Translation, the sleeve is the only operation I know how to do. That's what the surgeons tell you is the best. You have to match the operation to the patient to have great success. I tell people I have the best sleeve results around. You know why? because I won't do a sleeve on somebody who shouldn't have it. So I'm gonna have low failures. Because if you want a sleeve and you shouldn't have a sleeve, the obvious one, patient's 500 pounds, I want a sleeve. It ain't gonna work. It's not gonna get you down 200, 250 pounds, where you need to be at a reasonable weight. It's not gonna work. Will I do it? No. I tell people all the time, I'm being fortunate in life that I don't need to take your money. I'm not gonna take your money. If you wanna pay me to do an operation that's not gonna work, I'm actually gonna tell you no. No, because my conscience doesn't allow. So you gotta match the operation to the patient. And that's a complex discussion, but there's some broad strokes that are very simple. If you're diabetic, the sleeve is a bad idea. It doesn't fix diabetes, the gastric does. If you're really heavy, your BMI is over 50, in the 60s, the sleeve is not gonna work. Yes, you're gonna lose weight. If you have to lose 250 pounds and you lose 100 pounds, what have you accomplished? Nothing for your health, because you're not at a healthy weight yet. So, large BMI, lots of medical problems, diabetes, high blood pressure, sleep apnea, the sleeve is not a good idea. Older, your metabolism is lower, you're gonna burn calories less efficient, the sleeve is not a good idea. The sleeve is better for somebody who's metabolically very active, who will exercise, who has 70, 80 pounds to lose. There are gray zones. There are gray zones, BMI 42, 43, 45. I tell the patient, look, this is the pros and cons, you choose. There are black and white zones. If you're 500 pounds, don't come to me for a sleeve because I won't do it. I'll tell you no, because it's gonna fail. And those are the folks that come back 5 years later and say, you were right, now do a gastric on me. Yeah, okay, now it's gonna cost you more, higher risk, more work, should have had a gastric in the first place. So if you go to a surgeon who says the sleeve is good for everyone, that is not a good surgeon. The first question you should ask a sleeve surgeon is, can you do a gastric bypass? If the answer is no, he's probably not offering what's right for you, he's offering what's right for the surgeon, because that's all he or she knows how to do. So do your research, match the operation to your health, to your BMI, to your medical problems. That's what I do. I can do them all. So when I recommend one to you, it's not because that's the one I want to do. It's the one that matches you. If there's a gray zone, I'll let you pick. The other day I had a patient ask me at a BMI of 32 for a gastric bypass. And I said, if you want it, I'll do it, but I don't recommend it. You don't need a gastric bypass. You could have a much simpler sleeve and end up at a perfect weight. So, there are times I recommend against the gastric bypass, low BMIs, but there are times that the gastric bypass is the only viable option. I'm recommending what's best for you, not what's best for me. What's best for me is to do 5 sleeves a day. Why? I do them in 40 minutes. I make more money. But what's best for you may be a gastric bypass.
So just a little note on that. For those who are interested in knowing more about the surgery, we do offer virtual consultations where the coordinator will take down your information, height, weight, BMI, any medications that you're on, any previous surgeries, and you'll speak to Dr. Sosa on the phone, and he will let you know which of the 2 procedures he recommends. And then you can continue to do more research at that point, or you can then move forward with deciding which procedure is best for you.
If you're in the gray zone and you ask for a sleeve, we're gonna do our best to give you a sleeve that's gonna work and to give you all the other support to make a sleeve work. But trust me, if I tell you after operating on almost 20,000 patients, 20 years, that a sleeve is not a good option, maybe you should listen to me, because you're kind of gonna throw your money away. I'll still try to make you a good sleeve, but it's probably gonna fail. And I go by statistics. There are some BMIs that statistics show a failure rate of a sleeve 80%. As a surgeon, I don't want to offer that. I don't want to offer somebody an 80% failure rate. So when I recommend something, it's what's good for you. Probably you should listen to me.
Along the lines of recommendations, so this is both for patients that are interested in having weight loss surgery, patients who have had weight loss surgery, patients who are in our just regular weight loss program, whatever it is that you're seeing us for, follow the guidelines. They're there for a reason. Like he said, we've been doing this for over 20 years. Our nutritionists have been with us for a very long time. All the diets have been co-created by Dr. Sosa and the nutritionist. Our vitamin was created by Dr. Sosa. So a lot of the things, going back to what we originally said, a lot of the things we recommend, we actually do. But besides that, the recommendation is there for a reason. I mean, I was talking to a patient who's 5 years out of surgery, And one of the talks I have most with the patients, since I was a personal trainer, is about exercise. It's about exercise and building muscle. And this misconception that's out there that, you know, when you have a lot of patients don't want to have the gastric bypass because they're going to lose too much weight and they're going to lose too fast and they're not going to look good. Well, the truth of the matter is that is not a true statement. And anytime you are losing weight, you need to exercise. You need to exercise and you need to take your vitamins. It is so important to build muscle while you're losing weight fast. So your body doesn't know the difference between muscle and fat. And a lot of times that's why you think you're getting too skinny, but when you weigh yourself, you're not getting too skinny. Your BMI is still where you need to lose more weight, but you're not building muscle. So we give you all of the tools. We give you all of the handouts. We tell you what to eat. We tell you the protein you need to take. We tell you the vitamins you need to take, but you have to do it.
Right.
We can only take you so far.
We can't go to the gym for you. And I'm going to give you, for what she said, the medical reason. When we first do the surgery, you're starving. You're literally starving. You're consuming way less calories, 400, 500, 600 calories. So your body's starving. When your body's starving, it needs to make new glucose out of the stored glucose. The glucose is stored in fat. The glucose, which is converted, is a very long chemical formula, but that's what it is. Or you can also use muscle to break it down and use that. Your body doesn't know the difference. Your body doesn't care. Your body needs energy. So it's going to break down your fat, make you skinnier, and your muscles. Your muscles are going to shrink. There is a medical thing called an anabolic signal to your muscles. If you start exercising, resistance training, there's a signal, a complicated hormonal insulin-derived signal that says to your body, you are not allowed to use the muscle for calories because we're using the muscles for something else. At that point, you only burn fat. You don't burn your muscles while you're rapidly losing weight. So you look in the waiting room and there's this person that looks glowing, good shape, has lost 70 pounds since the gastric bypass 4 months ago. You look at the other person, had a gastric bypass 4 months ago, lost 70 pounds, and looks. What's the difference? Exercise. That's it. Exercise. And people say, oh, by my face. When you exercise and you're doing weights, you're actually working on your muscles. I do it all the time because I'm grumpy.
I tell him, can you try not to look so ugly while you're exercising?
Exercise will make you skinny and attractive. No exercise will make you skinny and healthier, but you will look drawn and gaunt. The key is exercise.
Yeah, exercise and supplementation.
Yes.
Very important to
I take my own vitamins, so I believe in them.
Just real quick, last thing we're going to touch on for today's live is just real quick on the vitamins. So we have the vitamin line. The vitamin was designed for bariatric surgery patients, but if you did not have bariatric surgery, you can still take the vitamin. I began taking the vitamin actually right about the time I got pregnant with our son, and I would take our multivitamin and the prenatal. I think it's one of the reasons he's so smart, not because of his father. So if you did not have surgery, you take one vitamin a day. If you had the sleeve, you take one vitamin a day. If you had the gastric bypass, you take 2 vitamins a day.
They're designed that way. You will never get toxic by taking 1 a day, and if you had a gastric, you need 2 a day. I designed them. The mathematics is there. If you ever want me to do the mathematics, the RDA for you, I can. But trust me, they're designed that way.
And so since they were designed for gastric bypass initially, the bottle is for 1 month for gastric bypass patients. So if you did not have a gastric bypass, you can either share the bottle and it's for a month, or the bottle will last you 2 months. And I highly, highly recommend the way that we eat in this country that everybody's on a multivitamin.
Whether it's ours or not, everyone, whether you have surgery or not, everyone should take a multivitamin every day.
Absolutely. So I think we're going to wrap this up. I want to thank you guys for joining us. We will be back next Wednesday, same time, same place. We will try to do this every week. He is a surgeon. There might be a week where he's running late or he can't make it, but we will try our best to be here every Wednesday at 12:30.
If I'm not here, she'll be here. Better half.
And if you can't make it onto the live, go ahead and DM us your questions and we'll be happy to answer them on the next live. So thank you guys so much for joining us, and great to see you all, at least online.